think now the AUC has been, the AUC is concluded. I think even the discussions in Mombasa is trying to see whether he can be on the same side with Raila Odinga, so that probably they are on the same side. They can agree on the commissioners that will be appointed. That's the way I see it.
Okay. Just take you back to the matters of diplomacy. Now that the United States is withdrawing its funds, because President Donald Trump seems to put America first, can we survive on our own?
It's not easy. You know, those programs, especially on health, like you said, were very important for our people. And those were serious funds that were coming into the country. It's a very serious gap. I don't know already we are struggling. You know, our economy is struggling even to fund, you know, to support our budget, you know, on the current and development expenditures. So the withdrawal of those funds for those interventions, especially in the health sector, is quite a serious beating to the country. I must tell the people of Kenya, we are having a difficult time, and we just have to tighten our belts. Things will be quite thick as we move on, but we just have to struggle and see what to make out of it.
Okay, well noted. I'd like to bring your focus to matters that are facing the Kenyan public.
Yes.
You've already talked about the withdrawal of the rural and urban private hospitals offering SHA services. I think they mentioned that they'll only offer emergency services. Apart from that, they're withdrawing services from SHA due to that figure, the NHIF arrears having been paid till date. And it's not just that. There are a couple of issues still in the education sector. And recently you mentioned that, you know, the State House at Nairobi is the epicenter of corruption. So talk to us about this in light of the challenges we're facing. What's the solution? We're not here to whine, we're here to provide solutions as well.
Rogers, President William Ruto said that he's a PhD holder. And the rest of us who don't have PhD should not tell anything. I had some discussion with some people yesterday on Saturday night in Melbourne. And they were wondering if this is where PhD has reached us as a country. Whether there is any need for anybody to ever aspire to our people. All systems are destroyed. The health system has collapsed. Today, the private hospitals are withdrawn from SHA, and they normally take care of 47% of the country. So where do those people who go to the national hospitals go? And this SHA thing was rushed because of corruption. The whole genesis of this program and why it was pushed down the throats of the people of Kenya without proper and adequate preparation was because of conflict of interest. There is a system, a management system for the SHIF program that is costing 104 billion Kenya shillings. That is the gist. That is money that people are taking, people in government. More than 80% of that money will go to people's pockets. The NHIF had proposed that they only needed 700 million to upgrade their system to manage the health system. Okay? So what has happened because of this corruption? There's a nation called Jayesh. He's the one who is behind this thing. He works with Adani on behalf of people in government. Because of that, the program was rushed without being thought through. There are people who are owed money by NHIF. Nobody talked to them. We just migrated to a new program without thinking through what it is. When we were campaigning, we had promised the people of Kenya that the ordinary Kenyans were paying 500 shillings, we were taking to 300. What has happened is that nobody can afford the system, and the system itself is not working. So, a government that cannot have a working health system, I'm actually happy to be under this government. I would be very embarrassed if I was deputy president. Today, I would be very embarrassed. When I meet old women and they ask me, you are the deputy president, we had a working health system before you took over. 2 years down the line, the system has collapsed. What are you? Who are you? I would be very embarrassed. In fact, sometimes I sleep here, I wake up at night, I'm happy I'm not deputy president. Because I would not know what to explain to the people.
Okay.
So, we are having a crisis of monumental proportions in terms of our health system. And I really feel for the people of Kenya. I don't know what will happen. Now that the private hospitals have withdrawn from the system and people are paying through their payslip and they cannot access health care, what do? I was talking to some policemen today as I came from here, and they saw me on the road and they said, Afandi, we support you. We are complaining even more than ordinary Kenyans. We cannot access health care. The teachers are complaining. You know, the teachers have a good medical system with some hospitals. And a decision was made to remove the insurance so that it's given to some hospitals owned by that Asian college. Today, teachers are going to hospital, they cannot access medical care. Everybody is crying. The whole country is in tears. And it's just 2 years down the line, you know. And I looked at, I saw after the AUC, I saw a fellow who works for the National Intelligence Service, an MCA from Nairobi here, called Alai. He wrote a big post trying to blame President Uhuru Kenyatta that he is the one who campaigned Raila Odinga at the AU. Okay. I want to tell those people who and ODM to leave Uhuru Kenyatta alone. Uhuru Kenyatta was president. His project did not go through. He conceded. He handed over power. 2 years down the line, you cannot keep on blaming him for every problem in Kenya. Even when Raila Odinga does not succeed in AU, you bring President Uhuru Kenyatta. President Uhuru Kenyatta left.
Let me reel you in. Back to, away from Uhuru Kenyatta, because we've talked about that. Let's talk about solutions. If Kenyans are to trust you with the leadership of this country, what would you do different?
First and foremost, governance is about the people. The first thing you do if you want to govern well is to listen to the people and never assume them. Had we listened to the stakeholders in the health sector, we will not be in the hole we are in. The first thing we'll do when we form government is to call the stakeholders and listen to them. And the people of Kenya, my brother, are very knowledgeable. We have an abundance of human resource in this country. People are extremely intelligent and very knowledgeable. But we have a government that listens to nobody. Nobody talked to people in the health sector. You need to talk to the doctors, you need to talk to the hospital owners, you need to talk to the paramedics, you need to talk to the nurses, you need to talk to the patients, you need to talk to the ordinary people. But I know that we could reform NHIF at a very small cost of less than 1 billion shillings and just improve on what was already working. You know, the Englishmen say, if it's working, don't fix it. We would have just taken NHIF the way it was.
So that's what you do?
Yeah, take NHIF from where it was, talk to everybody, talk to all the stakeholders, because they know they are the people in the medical world.
Then what do you do about the proliferation of funds through NHIF? Because this was an issue, not just...
That is what we should have dealt with.
Okay.
You don't, if a leg has passed, you don't cut it away and throw it away and look for an artificial limb. You try to find why there is pus. So what we did is that we said because people are stealing from NHIF, we throw it out and bring a new system where you steal upfront. Because that is what is happening with the SHA and SHIF. We are stealing upfront. 104 billion. That is stealing upfront. And this money for SHA is being taken to a bank that has been bought by the powers that be. Even money for the housing program is being taken to a bank. We'll be giving details.
So you don't have those details now.
I have them, but I will slow. We can't give Kenyans everything every day. The money for the housing fund, because one, the Ministry of Housing has no capacity to absorb those funds. The PS was saying they have made 2 billion shillings. Why were we deducting people money from the payslip to keep it in the bank? It's very insensitive. We started a levy fund without an infrastructure to absorb the money. The Ministry of Housing, the State Department of Housing has no capacity to absorb those funds. And they cannot even let the National Housing Corporation, which has a proven track record of building houses, do it. This money, more than now than 100 billion, has been collected from workers and from payslip holders. There is a bank that the people in power vote.
Which bank? Give us something.
There is a bank.
Yes.